Hey, everybody, welcome back to the EnergyMD podcast, where we help you resolve your chronic fatigue, ME/CFS, and long COVID by finding the real root causes of your symptoms, which are a combination of heavy metals, chemicals, molds, infections, and trauma, so that you can get back to living the life that you really want to live. So, today I'm going to be talking about how much of your symptoms is your trauma, okay? And how can you figure out how much that is? And it's a little bit of a trick question, but based off my last decade of doing this work, I have found that for some people, doing the trauma work is about 10% of their issue, and for other people, it can be up to 70 or 80%. So notice I didn't say 100% because I have never seen anybody who has worked on the trauma work that also didn't need to work on these other causes. This toxic five that I talk about, the combination of the heavy metals, chemicals, molds, infections, and trauma, they're all interlaced and they all cause nervous system dysfunction. So if you are doing a trauma program, whether it's the Gupta program, DNRS, biology of trauma, primal trust, these are all wonderful programs that I highly recommend and that I do recommend that people do alongside with our program. But what I have found is that these programs are not complete. They're working on the mental and the emotional, and they are causing nervous system dysfunction, but the heavy metals, the chemicals, the molds, and the infections, all on their own can cause nervous system dysfunction. And when we talk about trauma, essentially we're talking about stressors, right? This can be anything from really significant abuse to something that may be considered more mild, kind of like I had, which was rejection of a peer group, or the fact that you grow up in a family that has, parents or where you have siblings, so that there's never enough love to go around. And in order to become safe, when we're raised by imperfect humans, which are parents, by nature, our job as humans is to survive. And so we need to accommodate. And so, unfortunately, the things that allowed us to survive as we were young and live in a dynamic relationship with our parents and with our siblings gets to a point where it no longer serves us. And that's when we have to go through one of these processes. And so, those stressors are very similar to other chronic stressors, which are the heavy metals, the chemicals, the molds, the infections. And they end up causing deficiencies in the body, deficiencies in hormones like adrenals, thyroid, sex hormones, causing vitamin deficiencies, mineral deficiencies, mitochondrial dysfunction, which produces 70 to 90% of your energy. This is one of the main reasons why you have low energy when you have chronic fatigue syndrome or long COVID. So all of these chronic stressors contribute to the symptoms that you're having today. So how to determine whether or not it's 10% or 90%? It's really hard to say. I don't have a great equation for this on being able to figure it out. This is why I recommend so highly that people do a program while they're doing our program. Now, sometimes I recommend that you do it before our program, especially if you're really sensitive to supplements. So somebody who has MCAS or mast cell activation syndrome, it's challenging to do the work that we're trying to do with removing these toxins without being able to tolerate tinctures or supplements or some of these other tools that we're using. And so consequently, when your nervous system is significantly dysfunctioned, then you can have a hard time tolerating a number of these different supplements that are necessary in order to get the toxins out of your body. So in general, that would be a time when I recommend that you do it before you join our program. Otherwise, usually we'll have people do it once they get through the learning curve of our program, which is generally around 3 months or 6 months. But whenever you can incorporate it, it's going to be significant. It's going to be important. So each one of these programs that I've mentioned, the Gupta program, DNRS, biology of trauma, etc., they're working on a number of different things. They're working on neurolinguistic programming. These are some of the tools that they use. They're working on cognitive behavioral therapy. They're working on mindfulness. They're working on neuroplasticity. They're working on somatic experiencing. They're working on polyvagal, different polyvagal techniques in order to reset the vagus nerve, which is a main component of the the nervous system. So essentially with the autonomic nervous system, you have the parasympathetic nervous system, which is rest and digest and heal. And then you have the sympathetic aspect, which is fight, flight, or freeze. And you can't exist in both at the same time. And so in general, we want to be in the parasympathetic more frequently, more often. And part of the reason why you got sick and why you have your symptoms is because you're in the sympathetic nervous system. So we work on some of this with supplements, but doing these different techniques that I mentioned in some of these different programs can be incredibly supportive for the work that we're doing. So once again, it can be 10% of your challenges, or it can be 90%. So really important to make sure that you have that on board. I've just found out time and time again, I used to consider it optional, and now I consider everybody that I work with needs to be doing this kind of work. Now we do some of it in our program. We have a mindset practice where we have people doing gratitudes and envisioning their ideal day and looking at any sort of limiting beliefs they have and flipping them into empowering beliefs and looking at any sort of disempowering questions that you might be asking yourself and flipping them into empowering questions. And then we have a meditation component of our program, but we don't have an official trauma curriculum per se. So we still recommend complementing it with one of these other programs that I mentioned. So if you want to get rid of your ME/CFS or your long COVID, definitely you want to make sure that you're addressing all of the toxic five. So this includes the trauma. So this is the combination of heavy metals, chemicals, molds, infections, and trauma. And you need to address all of these, right? All of the heavy metals, all of the chemicals, all of the different kinds of molds and mycotoxins, all of the different kinds of infections, because you want to make sure you leave no stone unturned. So if you want to learn more about the work we do, check out the links below and have an amazing day.
I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening and have an amazing day.